Hello, hello. How are you?
How are you?
I'm doing fine. Hello,
That's great.
everyone. I'm going to try one more time to bring in Instagram and see what happens here.
I'm so proud of you with all this technology. Just navigating through it like it's nothing.
I think we almost got it. Gotta go. We gotta go. Public. Next. And the show must go on. Hey, everyone. So if it's not on, then hopefully we got the Instagram on too. But that's life. But
Yes, it is.
hello, everyone. Let me just say that I welcome and I'm glad that you're on board. And I look forward to sharing a few minutes with you to talk about some of the things that are important as we age. That's something that I'm going to be doing more of because we need information and
Yes,
education, correct?
right.
So
Correct.
I'm here today because I am passionate about health and fitness for older adults. I am a certified senior and women's health fitness, and I'm also a corrective exercise specialist. That is a specialist that helps correct the imbalances in our bodies with disease as well as injuries, and that's through exercise. So I am certified in that too. So I am passionate about being a fitness coach, but I'm also passionate about inspiring and motivating older adults on their health and fitness journey. And today, or not just today, but this month marks my 8th year as a breast
Yay.
cancer survivor. Hey!
That's right.
So
Celebrate.
it's 8 years as a survivor of breast cancer, and I don't take that for granted. I
No.
take it seriously, and I know that I am blessed. Now,
Yeah.
I will tell you, it's not been an easy road. There have been some bumps and bruises along the way, but God saved me, and that's the most important thing. So
Absolutely.
I am inspired to talk about and do exercises and motivate people who are on
Mhm.
their journey, not just of breast cancer, but of health. So
Right.
one of the things that I thought about is the fact that there are some things that we know about, some things that we don't know about.
Hmm.
And that's why I wanted to bring my guest on. And she's going to be talking to you in a minute. And it's April Woodyard of Caretaker's Heart Speaks. And what's so special about April is the fact that she was my breast care specialist for 5 years. And I just wasn't a patient. She just made me feel so comfortable. She made me feel great. She made me feel well. She was with me when I thought I had problems, and she always followed up and everything. So that made me feel good. And I like that April has taken it upon herself, not just in the office, but she also speaks and does workshops and motivates people on their health and their breast care and their breast cancer journey. And she is really good. I've used her privately at some of my events as well, and I've attended some of her events. So, one of the things that we're going to talk about today, and the reason why, and I'll tell you the reason why, is because what you should know about dense breasts. Well, about 4 years ago, after I did a mammogram, I got a letter in the mail and said, that I have dense breasts.
Mhm.
Well, no one ever told me that, and I'm like 74 now. Well, then I was younger, maybe 70 or whatever then, but no one ever told me I had this breast. I didn't know a lot about it,
Mhm.
but I told my daughter, and my daughter said, "Well, Ma, I have this breast." I said, "Well, you never told me." So the thing about it is, I said, well, if I didn't know or I didn't understand what it is, there are many other people. So in celebration of my 8 year survivorship, yeah, I decided to bring on my guest, and her name is April Woodyard.
Woodyard. Yeah.
She knows that I always say it wrong, so it's April. So let me show her. Okay, that's April. Hey, April, how are
Hi,
you?
I'm doing
Good,
great, and thank you
good.
for inviting me to talk about breast density today.
Yeah, well, thank you so much for coming on. And we know some people may see this now, or some people may see this later. The point is that people will see this because it's important information. We sometimes go about our day and we don't even think about things that really are important, or we don't know. So
Yeah.
I brought you in, and I wanted to talk about what you need to know about dense breasts.
Okay.
And some of the things that I had asked you about is, if you could explain to me what dense breasts are,
Okay. So,
is rather.
so just to give you a little background, I am a physician assistant, and I've been practicing since 1996. I moved to Atlanta in 2007, where I started to specialize in breast care. Prior to that, I was a primary care provider. So I started specializing in breast care, started in a private practice, and also became certified in breast ultrasound during that time. I also was trained to look at mammograms and preliminarily read them before the radiologist read them. And also, we learned to read ultrasounds, obviously, becoming certified. Um, Currently, I work in a breast care center, so that is all I do, breast care. So just to put things in perspective, around the early 2000s, the American Academy of Radio, American College of Radiology, started to advocate for women to know about breast density, because when the breasts are very dense, it can lower the accuracy of the reading. So the radiologist felt like the public should know that this can affect the reading of mammograms. So they wanted the public to know about breast density, because when the breasts are very dense, that means that you have a lot of dense fibroglandular tissue, and it appears white on a mammogram. And the problem with that is that breast cancer also appears white on the mammogram. So if you can imagine a sky full of clouds, and you're trying to see an airplane in the sky and you have a lot of clouds, that can affect the reading of the mammogram.
Okay. Okay. So who would most likely who would most likely need to be concerned about dense breasts?
Okay, so
What group of people?
there can be several groups that should be worried about breast density. So in 2019, Georgia passed the legislation stating that breast density should be on a mammogram report to notify you what category you are. So you can be category A, B, C, or D. So
Mhm.
typically, younger women have more dense breast tissue, but not always. Women over age 40 can have dense breast tissue, and also women who are taking hormone therapy can also have dense breast tissue, those that are taking hormone therapy after menopause.
Okay.
It
Okay.
can also be genetics. Women whose mothers had dense breast tissue, they may have dense breast tissue as well. And then women that have smaller breasts
Hmm.
can have dense breast tissue. Sometimes people think when their breast is really small that they wouldn't be dense, but it's actually the opposite. Women with smaller breast tissue may have more dense tissue than women with very large breasts.
Oh wow. Okay, so that would explain why I got the letter when I said I got the letter, because
Right.
I had never I had never received any information. So immediately when I saw that I said they said I had dense breast, I really started looking, and I'm like, okay, I need to check this out.
Right.
So are women with this breast more likely to this breast rather more likely to have breast cancer, or is it just less likely that it's seen if you have breast cancer?
Yeah. So that's the myth. People think, oh, if I have fiber glandular tissue or extremely dense breast tissue, I'm at a higher risk for breast cancer, because it makes it more difficult to read your mammograms. So mammograms are typically read by a radiologist, but they're also read by a computer. And now we have 3D imaging. Now, some hospitals, most hospitals, I would say in the Georgia region around Atlanta, are using 3D imaging, but some will be using the digital imaging, which is the 2D imaging. 3D
Hmm.
imaging is better because it looks at the breast at many different angles.
Hmm.
But with dense breast tissue, if you have the 2D imaging, it may be more difficult to see a mammogram, like I explained about the clouds in the sky. So the more dense your breast tissue is, then it would be more difficult to see a very small breast cancer until it becomes very obvious. So you
Hmm.
might miss the early diagnosis of breast cancer, which is important, because if you have early diagnosis, then there may be a chance for a cure.
Hmm. So, in other words, it's more likely. It's not necessarily that you will likely get breast cancer. It is more likely that it may not be seen if
Correct.
you have this
That,
breast cancer. So
that's right.
therefore, should we be getting additional screening when we get our mammograms, or should we uh, just rely on the mammogram?
Okay, so that is a question that's packed with a lot, because you have to look at the individual. So when we talk about standard of care, some organizations, or the hospital or the doctor's office, the radiological group, they will follow standard of care. And standard of care is for you to have a mammogram for screening. There are other imaging studies that we use, but some are used for women with specific problems with their breasts. Some are used for high risk. So the standard of care is not to use these other imaging studies unless it's necessary.
Right.
So a person who would get like additional imaging, like with ultrasound, could include a person who has cysts in their breast or a mass in their breast, and the ultrasound is used to identify where those masses are, and the shapes, the size. But it's not used for screening, because it's not as great at detecting breast cancer, especially early stage breast cancer, as a mammogram is.
Okay.
Um, and also, MRI can be used for patients who have a problem with their breast. Sometimes it's used to further identify something in the breast, but it's not typically standard of care to give someone an MRI for just screening, especially if they don't have risk factors. Now,
Hmm.
if you have risk factors, you have a family history, a history of an abnormal breast biopsy, or things that increase your risk over the average person, then we start to include some of those things for screening. Now,
Okay.
high risk can easily be determined by looking at your family history, looking at your personal history, and doing a calculation, which is called a lifetime risk calculation. And if
Mhm.
you're over 20%, then yes, you should consider other imaging for screening.
Okay, so that would explain maybe why my daughter's doctor suggested that she have additional screening because I am a breast cancer survivor
Correct.
and
Yep.
her breasts are dense. And so, in other words, is there like anything preventive from getting dense breasts, or is it just nature, or
It,
how does
it
that
is.
work?
Yeah, so when you're developing breasts, it's nothing that you can do to prevent yourself from having dense breast tissue. It's just a part of development. Some people develop it, some people don't. But we do know that as women get older, their breasts become, we call it fatty replaced.
Okay.
So you get categories of density. It goes up to the letter D as in dog. It's A, B, C, and D. A
Okay.
means that your breasts are fatty replaced,
Hmm.
and that it has the least amount of density.
Hmm.
But as women get older, if they started with some form of density, they typically the breast will progress towards fatty replaced.
Okay.
And that really explains why the breasts go from being very firm to actually less firm as we get older,
Okay.
because fat is very soft. So the
Okay.
firmness kind of gives us the lift. And as we get older, the breasts become more fatty replaced, which makes it easier to read your mammograms, but it also causes, the firmness of the breast to decrease.
So, in other words, that's a part of us sagging as well.
Yeah, I didn't want to use
Okay,
the word sagging, but yes.
can we get a break?
Exactly.
But you know what, like I had said earlier, is that as a 8-year breast cancer survivor, I'm still looking for information and education. I was blessed when I was diagnosed that I had already very informative about breast cancer because
Right.
of my work and workshops and seminars and fundraisers and races and things of that sort. So I was knowledgeable, so it didn't hit me hard. But I listened to a lady the other day, Chandra, at an event last Saturday, as a matter of fact, and she was saying that she kind of knew that she was going to have breast cancer because it was in her family.
Yeah.
And so she said that when she got it the second time, she said, "Okay, now this stuff trying to kill me." Okay. I
Right.
said, okay. So we always, as a survivor, you always are kind of nervous about
Right.
things. And
Yeah.
so when I got the letter that I had dense breast, I'm like, now what is this?
Right.
And I thought that, it's the fear about that has worn off because
Hmm.
now I know more about it. So I think that we are less fearful if we have education and knowledge.
Yeah.
So one of the things that I wanted to ask you is what I know that we talk about our health and our eating and what we drink and what we do. And for dense breasts, what are some of the cautions, or are there any cautions, or are there anything that you would suggest that we're aware of, because some of us may not get those letters. All medical professional institutions are not the same, and
Mhm.
some of us may not get that information. So, is there anything special you would recommend?
So I do want to say that in Georgia, it's a law. So you should get a copy of your report. But sometimes, like in the instance where I am, there's a portal, and your image, your report will be downloaded there. But a lot of people don't go into the portal to read it, and
Mhm.
a lot of people just want to read the bottom line. They don't
Right.
want to read all the description in there. So you
Mhm.
should have access to the report that tells you about your breast density in Georgia and some other states.
Mhm.
But and back to your question, there's really nothing that you can do to change breast density. What we do find is that if people have extremely dense breast tissue and say they have what we call fibrocystic changes, where with this dense breast tissue, they may suffer from symptoms
Mhm.
related to fibrocystic breast change. We know that certain things can cause these symptoms to be worse, like too much caffeine. And I talk to my patients all the time about caffeine, and people just don't want to give up their coffee. But I had really bad breast pain associated with breast fibrocystic changes when I was young, and the doctor told me to stop caffeine, and I did, and I had significant improvement in my symptoms. But
Mhm.
being just staying very healthy is always good for any part of your body. So
Right.
eating healthy, exercising. If you're eating more foods that are not good for you, you're going to feel worse, and you may suffer from breast pain, but it won't change the breast density. That pretty much is whatever develops in your breasts at the time when your breasts are developing, that's what you have until, like I said, you get to after menopause when your breasts start to become more fatty replaced.
Mhm. I'm glad you brought that up because one of the things that I'm strong about is telling people to go to that portal
Yeah,
and look at it yourself
right.
and read everything in it
And
because
ask questions.
yeah, you can ask questions because, and sometimes just reading it answers a lot of your
Right.
questions, and but you have in the portal you have that opportunity to ask questions. I've asked you questions in it before, and you have that opportunity, and the key is that you have to know you.
Yeah.
You have to know your body because no one knows your body better than you do. So
Yeah.
that portal, if people can get it, it's online. It is so imperative to so many things. I do it, keep it for my mom's. I keep up
Yeah.
with hers,
Yeah.
and then you'd be amazed. I mean, even with things like it doesn't even have to be breast cancer, but it
Right.
could be something that if is that you're eating that could cause the pain, you
Right.
know. So
Yeah.
I noticed that as a survivor, I noticed that lifting weights, I can't lift the heavier weights that I used to
Right.
because I start to get the pain.
Right, because the
Yeah,
muscle wall is behind the breast. We have to remember, we have all this fatty tissue, skin, and everything above the muscle, but underneath that is muscle. So sometimes, right, patients can say they're having breast pain, but it's really muscular pain. Sometimes people think when they go into the gym for the first time that they're not going to be sore or have pain, and they come in complaining of breast pain. But you're right, and also chocolate and cocoa has caffeine in it, and people don't realize like anything with caffeine in it, sports drinks and things like that,
hmm
can cause your breast to feel really engorged, heavy, and have pain. So sometimes it can be simply just changing your diet that will correct it.
right, yeah.
Yeah.
Yeah, so I'm actually for myself. I made the decision that I was going to not try to do the heavier weights. That's just
Yeah.
that because it
Right.
always. I'm thinking that oh yeah, I feel better now, and then 2 or 3 days later, I start to feel the pain, and
Right.
it may not even be because I'm a breast cancer survivor. It could be just because of my muscles.
Yeah. Exactly.
And definitely because of what you eat, because I'm a witness that I can feel the difference if I eat too muc sugar, if I'm eating sugar.
Yeah.
So I
Me
know
too.
that was not something that I should have been eating.
Right. Yeah.
So the key is with can we like talk about the key because we're on here and we're talking about what you should know
Okay.
about this breast. And
Yeah.
so, is there any any key takeaways from this?
Yeah, I actually have a lot. Sometimes when I go out to speak, it's just like I don't want to overwhelm the audience with so many things because breast care and breast cancer, it's a lot of information that you can give to the audience, but you don't want them to become overwhelmed. So what I would say is number one, you should know what your breast density is. And so you should get your mammogram report and not the letter that says everything was fine. My mom recently had a mammogram. She said, Mom, I got a letter. My mammogram was good. And I said, well, I need to see what the report said because the report is very important for you to see. Sometimes in the report, they may have seen something on your breast and done additional imaging and said everything was clear, but you need to know that something was seen so you'll know, what to watch for or when to follow up. But
Exactly.
you need to know your breast density, and that would be category A, B, C, and D. And like I said, the higher the letter, the more dense your breast tissue is. So D is extremely dense. A would be fatty replaced. B would be like scattered fibroglandular tissue.
hmm
And C would be, we call it heterogeneously dense, but that's kind of like 75% of your breast tissue is dense.
hmm
So you need to know the category. Secondly, it's important, along with breast density, if you're concerned about additional screening, to give your provider the information about your past medical history, including if you've had any breast biopsies, your family history, if anybody in your family's had breast cancer, and that lifetime calculation that I told you about that I do a lot for my clients. it can tell you if you're a high risk patient versus someone that's low to moderate risk.
Mm-hmm.
And those that are high risk would need additional screening. So you would want to know if you're considered high risk, because you want to know if you need additional imaging like ultrasound and MRI.
Right.
So those two things are at the top of the list for breast density. And the third thing is, one of the things that I do with my patients, and not everybody may have access on the portal to images, but I actually show them the images so that
Mm-hmm.
they can actually get a visual of what their breast looks like. And I show them the comparison to the four different categories and where they fall in the category, so that they can see why it may be more difficult for a radiologist to read their mammogram because of their breast density. So sometimes actually seeing your breast density kind of makes things click in your mind. But I don't want you to become paranoid about breast density, because, like I said, we have 3D imaging in a lot of places that
Mm-hmm.
screen for breast cancer. And the 3D imaging is like, if I was looking at this pad like this and this would be 2D, but the 3D imaging actually allows them to see every angle of the breast and go kind of comb through those areas. So those little small things can be picked up by 3D imaging. So if you have access to having a 3D mammogram, I would strongly suggest it.
Right. Well, you know what? One of the things that I'm glad about is that we're providing information and
Yeah,
education.
right,
And I'm an advocate of talking about, not just talking about breast cancer, but breast care.
right.
So many people have been affected by it, but so many people have not been affected by breast
Yeah,
cancer. So you want to know different things particularly as we age, and we are more susceptible to different diseases and different
yeah.
things that may happen in our life. So we want
I'm,
to have. Okay, go ahead
I
on.
wanted to say I'm glad you said breast care, because my business, Caretakers Heart Speaks, I go out and do speaking engagements, workshops, work with individuals one on one. But before, I would go out and tell people I was a breast care advocate, and people never really like understood it. So what does that mean, breast care advocate? So I had to start saying, what I speak about is breast cancer awareness, because people are like, oh, okay, now I know what you're talking about. But
Hmm.
you're right, the care starts before the diagnosis. And that's what I want to stress so much. And that's why, I try to get out to the community to get people to have events or meet with me, a workshop, personal, private events, because it starts with the care. Like you said, it starts with care with any disease that you have, or condition or diagnosis that you've gotten. It starts with the care before that. And actually, the care before that could prevent a lot of these things from happening.
Right. Well, that with that said, I just want to bring up the fact that your uh, you came to my church, and you did a workshop after church
Yeah.
because I'm the health and fitness administrator at my church, but you did a workshop,
And we
and
did
I think,
bingo.
yeah, with the bingo. And I
Yeah.
want to tell you that so many people uh, learned so much from that. And there were some survivors in there, some not, but they learned so much from you coming out to the church and doing that workshop. And so we got our spiritual and we got our physical health that day. And they
Yeah.
were so we're inviting you back again. Hopefully this year you
Yeah.
come back again.
Absolutely.
And
I love to.
because it's so good for everyone to have that information. And as a result of that, we one of the on my team, on my health and fitness team, was a gentleman. He said, "No, we should do this more often." So we wound up having a health and fitness fair in September
Oh,
last year,
that's
and we had
awesome.
a total fair, which was really nice, and we're doing it again this year. So,
Nice.
one thing can lead to another. So we're winding down. We're at our 30 minutes, and I want to really thank you for coming on, April,
Thank you.
because I think that you provided some very important information, and I want to show people how to get in touch with you
Thank you.
on Facebook, and you're on Instagram, and you're on Facebook,
Hmm.
and Caretaker Heart Speaks. And I want to thank you for sharing that information. But if they go to your website, they could find some of the videos, some of your videos, and you do them on Facebook too, but
Yeah,
some
YouTube. Yeah,
videos that
YouTube
you
video.
have done with different things that have to do with breast cancer,
Yeah,
breast care, and health.
breast care, right?
Yeah. And so breast care and health. And so it is breast awareness, but I call it caring for your body.
Yeah, absolutely.
So they will find that. And is there anything that you have coming up soon or anything else you would like? I know you're in Atlanta, but you also do things online. But
Yeah.
is there anything you'd like to share that you have coming up?
Actually, the biggest month for me is October, but I do want to emphasize that what I do is I do private or group or health fairs and all that stuff leading up to October. So anyone that's having any event coming up, even if it's your employer, you want to do a health fair on your job or anywhere, if it's a personal event at your home with a few women, intimate situation with that, yeah, I'm open to that. Or virtual, if you want to do like a virtual workshop. And I do try to include things that are fun because, you
Yes.
don't want the word cancer kind of makes people, kind of shy away from wanting to get the information. But we're talking about, like you said, care before the diagnosis as
Mhm.
well. So I like to incorporate fun things. I like to have giveaways, where I give
Giveaways,
away
and you gave
prizes.
us some lotion for to
Yeah,
keep our breasts moist. So it's so
yeah,
much information
yeah.
you can have because all they think about is the breast cancer, and
Right.
we got to think about survivorship
We do.
and
We do.
striving and surviving. So it's so
Right.
many things, and I want to tell people that. Thank you for coming and thank you for showing. I know some people will
You're
see this
welcome.
afterwards, but I also am going to be doing a series of breast care, breast cancer exercise because it's important that if you've been diagnosed with breast cancer or you're going through it or you post, there are
Yeah.
things that you could do to help get your routine, your life back in check, even
Yeah.
simply as raising your arms. So
Right.
you like you, I do it normally during October, but it's been just on my heart to do it more than that. So I have a series coming up where I'm actually going to be doing classes where
Oh, awesome.
people can do where because I'm trained to do those kind of exercises where I could show people how they can get back to their normal routine. And even if you never exercised before, but some of the things that you could do to help you get back on track. Get My theme is getting my healthy back, getting your healthy back. And
Yeah.
so I will be doing those things online and I will be posting. And I've got both of my Instagram sites, but I'm on uh, Facebook as well and YouTube as also. So
Yeah.
I want to thank people for coming out. Again, my guest is April Woodyard.
Woodyard. Woodyard.
And April Woodyard, a caretaker, and did I? Oh, yeah, I put your name up there. Caretaker Heart Speaks. And thank you so much for joining us. And we look forward to seeing you again on the road to healthy and fit.
That's right. Thank you so much again.
Okay, thank you.